The newest wave of medical assisted guidance has dropped from the medical health establishment, and what we see is now the news is talking about something like disease X. We don't actually know what the disease is, we're not sure, but we're already apparently making vaccines for it. They talk about the fact that what happened with Trump's vaccine and what happened with Project Warp Speed was it only took a year to make this vaccine. Well, this time we only have 100 days. Is anyone getting a bit suspicious? Anyone, just a thought, the fact that they're ramping up the processing of this and they're going to be bypassing so much of the different testing that's necessary. When we saw prior what was going on with the vaccines, they needed at a minimum 10 to 20 years of study per shot to see if they were actually safe. Isn't that just incredibly interesting? Trump boosted it up to a year, and now the establishment is talking about how important it is that we can get this out within 100 days. Isn't that just fascinating? Let's go ahead and get into it. We'll be starting off with this tweet from Michael Sington, and what we see is Beijing Hospital overwhelmed by crowds suffering from a respiratory illness. China and the Chinese government insist it's just the flu and not a new virus, which is very well possible. Even then, something we have to understand is SARS-CoV-1 was not a new virus. We had already experienced it, and with that, they actually already knew how to treat it. But what does that mean? That means that they understood the nature of how this had to be handled, and then they ended up rigmaroling every single one of us because they needed a way to go ahead and sidestep the processes that had already been found, because we need to go ahead and make extreme amounts of profits. We need a way to propagandize the people, and on top of that, this will also be a major control factor that will allow us to restructure society in whatever way we see fit. Obviously, these are just conspiracy theories, and that's just ridiculous, and no one would ever actually believe that. Now let's go ahead and get into this clip. No, this is a hospital. It's just overwhelmed with people. Everyone's wearing masks. And one thing I find so fascinating about this, and it's not specifically this instance, it's what people will take away from this. So many people are completely unaware that in Asian cultures across the world, what they do is when they're sick, they wear masks. In fact, they still do it in Japan, especially on places like the trains. And with it, many people who are foreigners that are removed from that culture that go to places like Japan, they don't wear masks, and with it, that culture ended up exploding after COVID, and it's still kind of maintained. People walking around don't really wear them as much, but nonetheless, people in really closed, confined sectors like public transit do. And you see so many people from like the West see clips like this, and they're like, "Oh my gosh, look at this! These people are so scared of this virus." It's like, no, it's roughly the time that they would be doing this. They do this to fend off illness, and it's just naturally been a cultural thing that they've done. We actually did this during the time of the Spanish flu. I don't know if anyone's actually seen the pictures, but there's a family standing there, and they all have white cloths on their face, which, as we know, didn't do anything. But what we do see is that they have a little cat with them, a little orange cat, and the cat even has a mask on. It's the cutest little photo. It's sad because you can see, obviously, these people are terrified, but the fact that they put the little mask on the cat is really cute. All right, now we go on. Here we see from Dr. Simon Gadek. Dr. Peter Hotz says disease X is coming, which will be much worse than COVID. That raises three questions. How would he know? How does he still live that unhealthily? When will he finally get arrested for his involvement in gain-of-function research? Three fantastic questions. You are not following Dr. Simon Gadek. He is someone who is persecuted by the COVID regime after standing up to the nature of what was going on through all of the nefarious propaganda that was being disseminated amongst the public. And with it, he was one of the only people that was actually trying to go through the data consistently, along with people like Dr. Robert Malone and Peter McCullough, as well as so many others that were pushing things like the Great Barrington Declaration, that were paying attention to Israel's data because Israel had vaccines before absolutely everyone, because Netanyahu had made a deal with companies like Pfizer that they could get the vaccine first and do so experimentally, and then they would give their data to Pfizer. And many people don't even understand this, and they avoid actually reading things like this because it would end up compromising what they understand about what happened during COVID. Nonetheless, I digress. We should really be throwing it into this clip now. Let's go.
Well, could the next pandemic make the height of the COVID-19 outbreak look mild? That's what some experts are predicting for what's being called Disease X.
So I am very worried that we just don't, we as a nation, we haven't made that commitment to really fully protect the American people.
We caught up with internationally recognized Dean of the National School of Tropical Medicine at Baylor and co-director of the Texas Children's Hospital Center for Vaccine Development, Dr. Peter Hotz, who's traveling to get his take on the topic.
We have a likelihood that new pandemic threats, that people call them disease X, are going to be rising on a regular basis.
And Dr. Hotz says disease X, the next pandemic, could hit hard whenever it arrives.
Why do you think some experts are predicting the next pandemic will make COVID-19 look like a walk in the park?
I've written about this as well. I wrote for the Houston Chronicle a couple of months back that COVID-19 is just a warm-up act. The next pandemic may not be as severe, but it could be much more severe.
After years of pandemics popping up, including SARS and H1N1 early in the 2000s,
Ebola in 2014, we had Zika in 2016, and now we've got COVID-19.
Dr. Hotz says that's why the U.S. Office of Pandemic Preparedness was created, but he believes more should be done.
Having the funds available to make countermeasures for new diagnostics, new vaccines, and at the same time, being able to support the virologists, the scientists who actually study these pathogens.
Why are we seeing so many pandemics?
It's one of the most common questions I'm asked. It's a confluence of 21st century forces. A big one is climate change, which is altering the migration of animals that can transmit these viral pathogens.
Now, no one knows when disease X, the next pandemic, will hit, but scientists say it is coming.
Dr. Peter Hotz, doctor, expert, health expert, arguably one of the most unhealthy people I've ever seen in my life. And with it, what do we see? We see Dr. Peter Hotz saying that we have to worry about disease X, and we have to be clear that we have to pay attention to the experts because it's important that we're weary of what could come. And he talks about the fact that, well, COVID, that was just the preliminary rounds. I know we're going to be having another round to come through. It's like, how? He doesn't explain how. He doesn't explain why. It's just, oh, well, you see global warming's making animals shift and it's changing their migratory patterns. But here's the thing. We already know that what happened with COVID wasn't because of migratory patterns. We saw that that was not from zoonotic origin. That was a lie, and it was from the lab in Wuhan. So you're clearly talking out of your ass. Dr. Peter Hotz also being the man who was challenged to debate RFK Jr. on Joe Rogan, and with it, he denied, the entire internet turned on him, and he blocked everyone. He made sure no one could read his posts. He made sure no one could respond to his posts, only people he followed, only people he wanted to interact with, because he was curating his sphere of influence, because he knows he is against the world on this one. And what do we see? We see that they're talking about the timeline of how important it is that we can get this next vaccine rolled out, because the fact is that we have to make sure that we're paying attention to taking care of people. We saw that we had this vaccine roll out, and what we saw was, man, we got it out within a year under Project Warp Speed, but what's really important is that we can get this out within 100 days. Does anyone actually trust this? Like, genuine question. Do you believe anything that these people say anymore? Because I know I certainly don't, and it sucks because it's made so many people look at the medical establishment and doctors with an incredibly skeptical eye, which I say it sucks. It's also a very valuable thing because you can realize how many of the people within the medical establishment, whether it be nurses or doctors, are realistically nothing more than people that read off of paper and have no idea what they're talking about. They just read the thing that's handed to them and they say the thing they're supposed to say because they believe that's what they're supposed to do, and they mean well, and they actually really want to help you. I believe that. I believe that in my heart of hearts. But nonetheless, they're just going along to get along, and they're doing what they're told, and that's realistically what people do. They just do what they're told, and they don't know anything about why they're doing what they're doing. And that, I believe, is one of the things that led to the major blowback from what happened when we saw with the COVID lockdowns, the COVID pandemic. And the fact is, people just simply don't trust the medical health establishment anymore. And can you blame them? Now we go on and we see they're literally working on a vaccine for a virus that doesn't exist yet. They call it disease X because nobody knows what it is yet. Can't make this crap up. And this is unbelievable. I saw this clip. I'm like, surely this is not real. And this is where they talk about shifting the vaccine timeline from 1 year with Project Warp Speed to 100 days. And when I first saw this, I was like, that's ridiculous. You can actually be trying to make vaccines when you don't even have the actual virus itself to understand what you would have to be preparing the body to fight off. But nonetheless, of course, the pharmaceutical industrial complex is just doing its thing, and with it, the government journalists and the media class aren't even asking real questions about it. They're just going along with it because we have to make this the new normal. Because as we know, that was the entirety of the point of what happened with us being brute forced with everything that happened during COVID. It wasn't about saving lives. It wasn't about making sure that everyone would be taken care of. It was solely about making sure that they could shift us into the standards of what they want, which is the new normal. Let's go ahead and get into this clip.
In some of the most secure labs in the country, scientists are already preparing for the next pandemic. It's just called Disease X for now, because nobody knows for sure which virus will cause it. But at its Porton Down complex, the UK Health Security Agency is scanning the horizon for threats and starting work on vaccines just in case.
What we're seeing is a rising risk globally. Now, some of that is because of things like urbanisation, where you may get species jumping, so virus jumping from, as we've seen with bird flu, into humans. Some of it is because of climate change, so this is a growing risk agenda, but then it's one that we can use our science actively to prevent human impact.
It took a little under a year to develop the COVID jab. The target for a vaccine in the next pandemic is just 100 days. Bird flu, monkeypox and other animal viruses capable of infecting humans are being closely monitored.
One early success is a potential vaccine against Crimean Congo hemorrhagic fever. It's spread by ticks with a fatality rate of around 30%. It's found in Europe and it's moving north with climate change. That's why they're trying to get ahead, and clinical trials are already underway.
We've got another dead bird. Not quite sure what that is.
But it is bird flu that currently tops the list of threats. Tens of thousands of seabirds have died this summer. There have been 4 human cases in the UK too. All worked in close contact with birds and all are well. But the National Trust, which looks after long stretches of the coast, is urging people to be cautious.
I think people are aware of bird flu and they're aware that there's dead birds that are being washed up. We're asking people not to go anywhere near the birds, and especially if they've got dogs, to keep the dogs on leads as well.
The bird flu virus has mutated and spread between some mammals, but the UK Health Security Agency says the risk to humans is still thought to be low. Thomas Moore, Sky News in Pembrokeshire.
I don't know about you, but I don't really trust the establishment class anymore when they talk about the fact that we have to worry about this abstraction that's just this random nefarious thing that you can't actually see. It's not physical, but you have to worry about it, and you have to always be scared of it because it could get you at any time. It's around any corner, lurking like a demon. Well, we saw that happen with the War on Terror. You didn't exactly know what was going to happen. You didn't know why it was going to happen or when it was going to happen, but it could get you, so you always had to be on guard. And with it, we had to make sure that we were gung-ho patriotism and funded the military, and we were attacking them over there so they weren't attacking us over here. It's ridiculous nonsense. And that's honestly how I'm starting to feel every single time I hear them talk about the fact of, well, you have to understand climate change is going to affect X, climate change is going to affect Y, global warming is going to affect Z. It's like, okay, well, here's the deal. The climate is changing, and man-made climate change is real. Global warming is real. But we're on the backslide from an ice age, and that's why global warming is real. So here's the deal when it comes to man-made climate change. If man-made climate change is as big of a deal as it is, why is it that people like the Joe Biden administration, who were talking about the nobility of how important it is to abandon fossil fuels to go to renewable energies, why is it that they just committed the biggest act of industrial sabotage and eco-terrorism in the entire history of mankind by blowing up the Nord Stream pipeline? These people don't actually care about these things. It's just another vector of control. That's literally all it is. The elites will be flying around on their planes and they'll be happily going around on their private jets using all of the fuel, but with it, you will be stuck in public transport using the local state transit ways. And that is just another example of how they do these nonsensical double standards. But what you have to understand is when you're dealing with people like this who believe themselves to be your betters, if they didn't have double standards, you would have to understand that they didn't have any. What do we see here? Massachusetts says it's being hit by a wave of pneumonia in children as Ohio County issues white lung warning after China and Europe saw a surge in cases and hospitalizations. County said the spike in cases meets their definition of an outbreak. Spread raised fear of an American outbreak of a disease tearing through China. Isn't that just fascinating? In Warren County, 30 miles outside of Cincinnati, there have been 142 pediatric cases of the condition dubbed white lung syndrome. Since August, a figure health officials there described as extremely high. Not only is this above the county average, it also meets the Ohio Department of Health's definition of an outbreak, the county's health department said on Wednesday. So, will this actually be taken with and run with, much like we know the establishment loves to do? If you give them an inch, they will gladly run a mile with it. Look at what happened with 9/11 rolling into the Patriot Act. Look at what happened with COVID and then rolling into having so much more control over the economy. Well, they'll gladly get the inch and they will run it and take it and drop that goalpost at the mile, and then they will sit there and chastise you for getting mad at them because they lied to you. And then they will gaslight you and tell you things like, well, this is actually your fault and you should have been okay with it. because that's exactly what the establishment does. And many of the times they'll also say, you know, we were actually never going to do this. We would never do that thing. That's ridiculous. The fact that people would have these conspiracies about the fact that what the US government would be involved in is just unbelievable. And then 20 years later, a document comes out. The government admits, yeah, we actually did that thing, by the way. We're moving on, but don't you worry. We would never do anything like that ever again. Yeah, I'm sure. And then you realize that they're doing other nefarious shit to a degree that blows out what they were doing in the past, and it makes what they were doing in the past look like child's play. All right. Now, we see this outbreak, and I was looking for articles about what was going on with outbreaks, and then I found something incredibly fascinating. How India has remarkably successfully fought polio. February 20th, 2012, and I was like, oh, wow, that's actually unbelievable. So it turns out they were using a oral vaccine in polio so that they could go ahead and fight the virus. And I was like, man, this is crazy. This is actually something that's really, really valuable. The fact that you could give all of these vaccines to so many people. And then I started remembering, I was like, but there was like a massive polio outbreak in India. And then I found this article from the AP. UN says new polio outbreak in Sudan caused by oral vaccine, which, by the way, funded by the Bill and Melinda Gates Foundation. But what do we see? And then I'm sitting here thinking, I'm like, oh my God, this is the oral vaccine that they were distributing in India. And then I go over here and I see oral polio drops linked to paralysis in India. So it's causing polio and paralysis, and the dominant strain of polio in Sudan and India is from this oral vaccine, experimenting on the third world. And now we go here. More current polio cases have been caused by vaccines than the wild virus. WHO report. WHO and other organizations use live oral vaccines while Western countries use a more expensive injectable vaccine containing an inactive virus. So, what do we have next? We have this. For all of those people that think it's absolutely ridiculous, it's nonsense, circulating vaccine-derived polio type 2 virus. That is what we were talking about. If you want to go see the data, it will be in the link in the description down below. I'm going to cut it there. These are things that I see, and I simply just do not trust the medical health establishment more and more and more. And with it, I don't think you can actually stop this train. I think when it comes to civil society and how they now view the medical health establishment, government, and many of the people within the elite class, well, the dam has burst and there is no stopping this flood. I'm going to call it there. Thank you for watching if you got this far. Thumbs up if you liked it, thumbs down if you didn't. Tell me where I'm wrong in the comment section down below. If you can provide me anything to read, I will gladly go through it. Stay lovely, stay great. Tell someone you love them. Peace out.